If you've ever been told you have a fatty liver and then sent home with no real explanation, stay with me for the next 7 minutes. Because what I'm about to share could be the difference between reversing this condition completely or watching it quietly progress into something far more serious. I'm a physician, and I want to walk you through exactly what's happening inside your liver right now and the specific steps that actually reverse it, not vague advice, real, actionable steps. Your liver is supposed to have a small amount of fat in it. That's normal. The problem starts when fat builds up to more than 5 to 10% of the liver's weight. At that point, doctors call it fatty liver disease. There are two main types. One is linked to alcohol use. The other, far more common today, is called non-alcoholic fatty liver disease, and it shows up in people who rarely or never drink. It's tied instead to weight, blood sugar, and how your body processes food. Here's what makes this condition so dangerous. Your liver has almost no nerve endings. It can be under serious strain and you'll feel almost nothing. No sharp pain, no obvious signal. That's exactly why so many people walk around with this condition for years without knowing. Even though fatty liver is quiet, your body does drop hints. Most people just don't connect them. Persistent fatigue that doesn't improve with sleep. A dull, low-grade discomfort, fullness on the upper right side of your abdomen, just under the ribs. Unexplained weight changes. Skin that seems slightly more yellow or sallow than usual. And in some cases, small red spots on the skin called spider angiomas. None of these alone confirm fatty liver. But together, especially in someone over 50 with a few extra pounds around the midsection, they're worth paying attention to. This is where I want to be very direct with you, because the risk factors aren't what most people expect. Carrying extra weight around. The abdomen is the single biggest driver. Type 2 diabetes and insulin resistance are right behind it, high blood sugar levels. Essentially force the liver to store more fat. High triglycerides and cholesterol imbalances also play a major role. And one factor that people almost never hear about, a diet high in refined sugar and processed carbohydrates, can drive fat into the liver effectively as a diet high in fat itself. If several of these apply to you, it doesn't mean you have fatty liver. It means it's worth what checked base, usually through a simple blood test and an ultrasound. Now here's the part I really want you to hear, because it's the reason I made this video. Unlike many chronic conditions, fatty liver disease in its early and moderate stages is genuinely reversible. The liver is one of the few organs in the human body capable of regenerating itself. Give it the right conditions, and it can clear out stored fat and repair damaged tissue over time. This isn't a guarantee for every single case, especially advanced ones. But for the majority of people in the early stages, the steps I'm about to give you can make a measurable difference within a few months. Step 1 part, weight, not starvation, righto. The research is consistent here, right? Losing even 7 to 10% of your body weight can significantly reduce liver fat. That's it. Not a crash diet, not extreme fasting. A slow, steady reduction through better food choices and movement. Step 3. What to add in: focus on foods rich in fiber and healthy fats. Vegetables, beans, lentils, nuts, olive oil, and fatty fish oil, like salmon. Coffee, interestingly, has also shown a protective effect on the liver in multiple studies, 1 or 2 cups a day, without loading it with sugar and cream. Step 4. Movement matters more than intensity. And you don't need intense workouts. Consistent, moderate movement, a brisk 30-minute walk most days of the week, has been shown to reduce liver fat, even without significant weight loss. Consistency beats intensity here, every time. Step 5. Get the right tests. If you suspect any of this applies to you, don't guess. Ask your doctor for a liver function panel and, if needed, an abdominal ultrasound. These are simple, inexpensive, and they give you a real baseline to track your progress against. Your liver works silently for you every single day, filtering toxins, managing your blood sugar, storing nutrients, without ever asking for recognition. The least we can do is pay attention before it starts struggling. If this video helped clarify things for you, share it with someone who needs to hear it, and subscribe for more straightforward health guidance. No fear-mongering, just what actually works. Take care of yourself. I'll see you in the next one.